Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, sporting the COVID hair, along with Dr. Millicent Rovelo, who is no longer sporting the COVID hair.
No, I am not. I was able to get with my hairstylist this past weekend, and it felt really good.
It looks great.
Well, thank you.
You're looking super coiffed.
Freshly coiffed.
Properly set up to be a Beverly Hills plastic surgeon.
That is correct. That is the idea.
I'm still looking like the caveman plastic surgeon, but that's okay. I'm into it. I'm going to go with, I can't get in until June 13th. So I still have a couple more days of shaggy style, which I'm fine with. I'm digging it. It's okay, and it's good. But we are here today, not just to talk about hair, but it's part of like the hair line.
Yeah, it's kind of
the brow lift.
Yeah, it's the brow lift. So if you have really shaggy hair and you don't like the position of your brows, it kind of works for you.
It does.
Yeah, it sort of just makes everything more camouflaged. But
which is good for me.
Which is good.
But brow lifts are something I love doing. Brow lifts. I think they're really important. And there's a lot of people that just don't even like doing them. They're like, nobody needs that. I think a lot of people need it.
I think a lot of people need brow lifts.
Yeah, I think brow lifts can really enhance the open look to somebody's face. Yes. Now, they have a bad name because of the old school coronal lifts that weren't really brow lifts. They just were. They made people look like goosed, like somebody came up behind them and
surprised them,
grabbed
constantly.
their butt, and they did the whoa, and that constant surprised look is not attractive.
I actually had someone literally just 3 days ago ask me about that. She's like, this girl I know, she just a few weeks ago came back and she just looks different. She just looks like she's surprised all the time. What do you think happened to her? I was like, I can tell you
coronal
what happened.
Brow lift.
I doubt it was coronal because this was 3 weeks ago. I don't know that that's happening much anymore. But she definitely got pulled very tight in some way.
Well, there's a couple of things. Okay, so brow lifts, when they go right, they're really right. They look amazing. And I tend to really, in my world, the lateral brow is mostly where the action is for me. It's about lifting that lateral brow and getting a nice arc.
The lateral brow is, for frame of reference, the out part of the brow.
The outer part.
Arching part of the brow.
Exactly. And you can really contour that arch. People try to pluck and tattoo and do all this other stuff, but we can do it surgically. But there are a couple of requirements. I mean, I think understanding where you want the brow to wind up is key. And I tend to do everything either endoscopically or with an open sort of endoscopic approach where it's very minimally invasive, small incisions.
Right.
And starting in the mid-30s, these brow lifts become really necessary.
Yes.
Do you think?
Agree. I completely agree. I think the brow is probably one of those areas that is one of the first places to sag in the face and to drop, but people don't realize it because they just don't know about it, or they don't realize it. But I feel like I see it now more commonly because of Botox. Like, I know I see it in myself because of Botox. Yeah. So Botox in the forehead to treat the wrinkles in the forehead, its one job is to stop movement of the frontalis muscle, which is the muscle responsible for elevating your eyebrows. And so it works because you're no longer elevating your eyebrows, you're no longer making those creases in your forehead, so your forehead is smooth, but now your brows are sitting a little bit lower than they might have if you hadn't been doing Botox. So that's when you really start noticing your brow position, because people will come in and they'll say, my brows are dropped.
Right.
And that's when you start noticing it. And I would say, usually late 30s is about when it starts to be noticeable.
And on that subject of that Botox issue, though, I mean, you can leave the lateral aspect, the outside part of the frontalis to pull up the brow. And so, if you do the totally frozen look, then that's not the case.
What I do a lot of times, too, is with the Botox. I just did this today on a girl. Is I do a lateral brow lift with the Botox. So I inject the orbicularis under the eyebrow to give it a little bit of a lift when I do the whole forehead, so that it sort of counteracts that descent. So there are things you can do with the Botox, but yeah. And
then we have a lot of people that come in and say, well, I don't want to have Botox a lot anymore, so I want to get a brow lift.
Exactly.
But they still wind up coming for Botox. It's just, you get addicted to the non-wrinkled look. I'm sorry.
It's true.
Plastic surgery is just, it's the way it is.
That's how it is.
You got to know.
You want to be smooth,
Yeah. So the way that brow lifts are done, the way I